And then it's always good for us to just pause a little bit and give a wonderful shout out to those that support us for these speaker series. We can't do what we do without them, and we are really honored to have them by our side. So we have quite a few presenting sponsors, which is West, Merck, and Daiichi Sankyo. And then we also have our friends supporting us at GSK, Lilly, and a new one, EO. So please, if you ever get an opportunity to connect with anybody in those companies, they support us. So give them a little thanks that we appreciate them, because
Yep.
we are doing well over 36 speaking series a year, and we cannot do it without the support of those that are in our community.
Should
All
we
right,
bring in
shall
our
we?
first guest?
Yeah,
A
why
little
don't
bit
you
of a
bring them
teaser.
in?
Yeah, wonderful.
Yeah.
So before we jump into the topic of sun safety and cancer, we have a very special guest with us this evening that I think, when we think of summer and warm weather, we're certainly thinking of sun health. But there's a lot of activities that happen over the summer. So we're really pleased and honored to have Catherine Wright joining us this evening. So Catherine is originally from Owensboro, Kentucky. She is a rising junior in the School of Nursing at the University of Pennsylvania. This is her second year as a Kesem counselor and her first year as one of the outreach coordinators. And if you're unfamiliar with Kesem and the program, they support youth that are affected by their parents' cancer diagnosis. And one of the things that they offer are summer camps. And it's an organization that has chapters all across the country. So Catherine is here to share a little bit about her camp that's taking place at UPenn, but we'll also be sharing how you can find out if there is a chapter in your area. So Catherine, thank you so much for being here with us tonight.
Thank you for having me. Yeah, so like Erin said, I'm from Kesem, specifically the UPenn chapter, but yes, there are chapters all throughout the country. What Kesem aims to do is to provide a support system for kids who are affected by a parent or a guardian's cancer. Our demographic is kids who their parent is currently dealing with cancer, they have had a parent pass away, or their parent is in remission. We have no restrictions on that. And our ages range from age 6 to 18 years old. We provide resources all year round, but like Erin said, our main flagship event is a summer camp. Regardless of the chapter, the summer camp is a week long. It is free, completely free to families. That includes there is no admission fee. If you need help with transportation, we can provide. If you need help with materials, we can also provide that. We try to make this program as barrier-free as possible. So if you ever need help with applying, like I said, with transportation or materials, with any internet access to submit your application or to reach out to us, we're more than happy to provide that. The camps across the country take places at different times. So for UPenn, we are August 11th through the 16th. Just a couple of things that we like to do at camp. We do plenty of outdoor activities. I know last year we got to do some zip lining, some go-karting, some pool time. We also do things like arts and crafts. The kids love that. We always have a talent show every year. And camp is just really a time for the kids to come and de-stress from the cancer that's so present in their lives. It's also, they really just meet that community, because a lot of kids that they know from school or just at home don't really understand what they're going through, but the kids at camp do. I've seen lifelong friendships form from this. It really just is a beautiful community that forms. Cancer is mainly at camp talked about when the campers want to talk about it. We don't bring it up too often unless they come to us. However, once a week, we do have an empowerment night where for roughly an hour, we all come together and people are allowed to share and talk about their experiences as one. If it's too much for campers, they're of course allowed to leave, but this is just really one of those unifying moments for the whole camp, to kind of remind us why we're all there, why this community is so important to all of us. And like I said, we do provide other year-round events, such as friends and family days, for just people to come and see what Kesem is all about. We also host virtual cabin chats, which are Zoom calls like this, for our campers. But yes, our main event is the summer camp. I really can't describe what it's like, the magic that it is, and how rewarding it is to see kids who come in on a Sunday very stressed, very scared, and then leave the next Friday just so happy that they came, and just a weight is lifted off their shoulders. And like I said, we are there to help with any different resources that we can, transportation, materials, everything. We are very cognizant of, allergies, disabilities, anything like that. We want to make this as accessible as possible. So I will be coming back over the summer to talk more about Kesem and how you can access it. But yes, I think Erin shared some links with you. So if you ever go on there, you can look to see where the closest Kesem is to you. That's not necessarily the one you have to go to if you know someone going to a different one. That's just easiest for you. You can go to see where the closest one is to you and what time of the summer that is. The great thing about Kesem is that also there is no really deadline to apply. It's just when we're full. And each camp has a different quota of people. But yeah, that's a great thing. So it's never too late to join Kesem. But I appreciate you all having me. Hope to see you back in the summer. And if you ever need anything, Erin can share my email with you. Anytime you reach out to that email, it'll be me responding. So now you have a face to put with the name. So thank you all so much.
That's great, Catherine. Thank you. Really happy to have you.
Thank you.
And Catherine's
Thank
going to
you.
be jumping back with us in July too. So I love that they have programs all year long, right? They have them all year long, but their main ones are in the summer. And Catherine, when we were at our Bloom Fashion Show this weekend, oh, it was powerful. And we do have some young mothers, and I just thought of you because I remember those days, and it's difficult for the kiddos and for the teenagers and for the parents. So to have this wonderful resource, we're really grateful.
Thank you guys so much. Enjoy the rest of your night.
You got it. All right. I think we are ready for our next guest. What do you think, Erin?
I think so. Let's bring her in.
Okay. Yeah. Hi there, Dr. Lucking. How are you?
Hi, I'm fine. Thank you.
Good, good. Well, thank you for joining us. Dr. Lucking is a board-certified dermatologist and inflammatory breast cancer survivor. And prior to her diagnosis in 2022, Dr. Lucking practiced general medical dermatology for 6 years in Lancaster, Pennsylvania, and taught dermatology at the Penn Medicine Lancaster General Hospital Family Medicine Residency Program. Dr. Lucking is currently as an inflammatory breast cancer advocate and volunteers on the Survivorship and Wellness Committee at Penn Medicine at the Ann Bashinger Cancer Center in Lancaster. She is also the creator of the healththroughcancer.com. It's a wellness website, so please check it out. I am sure Erin will get that in the chat. And that offers information on evidence-based integrative elements of health and breast cancer resources and support. Dr. Lucking is passionate about sun safety. We've all been experiencing some really warm weather, which makes us think about bringing out our sunscreen, cancer prevention and treatment, and really understands that holistic care, that whole patient care for integrated medicine, which aligns so beautifully with what we do at Unite for Her. So please join me in welcoming Dr. Lucking. So thank you again. Always good to hear you talk.
Thank you, Erin. Thank you, Sue. Yeah, so I'm a dermatologist. I love taking care of the skin, and I was practicing dermatology in the private practice world for 6 years. And then while I was on maternity leave, I was diagnosed with inflammatory breast cancer, and I underwent chemotherapy, surgery, and radiation. And that was in 2022. So I have my own story, and we all do. And I wanted to use some of the resources that I found and my experience to help others. And so that is why we're here tonight to talk about sun. And it's May, and I am excited to share with you all. And can you see this okay? There we go. Okay,
yep.
Great. So
Got
here
it.
we go. Let's get started. So what I wanted to speak about was some of the skin changes that we've experienced from cancer therapies. And we're going to take a bird's eye view of that because there are a lot of skin changes that can happen with cancer therapies. And then I want to also talk about some protection details and recommendations specifically for cancer patients, and touch a little bit on how we can optimize skin health and wellness, just to make ourselves feel better, look better, and to combat some of these treatments that we've had. So obviously the skin is amazing. It's our body's largest organ. It protects us from the sun, injury, the environment, infection, and we have our own skin microbiome. We regulate our thermoregulation, and we can also make vitamin D. So all of these things are very important to our health. Now, when we have breast cancer treatment, it affects everything, including the skin. And so first, I'm just going to do the bird's eye view of everything. So chemotherapy, it kills rapidly dividing skin cells, and it obviously wants to target and kill rapidly dividing cells in general, but that can also target skin cells, hair, and nails, which are dividing as well. So some of the side effects can be dryness, peeling, rash, redness, sun sensitivity, hair loss, and changes in our hair when it regrows. Mine was straight, it is now curly. I know some of us might have experienced that as well. You can also lose nails and then get inflammation or infections around the cuticles. And those are just a few of the things from chemotherapy. Then we also have surgery. And so surgery, we're disrupting the skin. We're asking the body to heal. Sometimes it heals in different ways. A thicker scar might have limited range of motion, more sensitivity or pain, cording, or our lymph nodes may be removed or disrupted, causing swelling and lymphedema. And that really changes things. And then we have radiation, where our body is just being blasted by radiation. It can cause a sunburn-like reaction. That might even be an anticipated effect. Sun sensitivity, darkening, dermatitis, sores, fibrosis, infection, and of course, sensitivity to the sun too, not just touch and sensitivity that way. And then many of us are on maintenance therapies for long-term. These may be targeted therapies, which are very specialized to our mutation or hormone receptivity. And then also immunotherapy as well. And these have their own risk of certain side effects too, as well. And so that just seems like a lot, right? Our skin goes through a lot. And one of the long-term medications we might be on that sometimes we don't think of having such a great impact, but it really does, is when we block estrogen and how that affects the skin too. So we have estrogen receptors all throughout our body, and including in our skin and our hair follicles. Many of our tumors may be estrogen positive, which is why we're on estrogen blockers. But also when we're during chemotherapy, our ovaries are often shut down, which can lead to a premature menopause or more of a complete menopause. This causes some effects in the skin, which are not so great. Some thinning of the skin, more wrinkling, dryness, lack of or loss of firmness and elasticity and collagen. It can also cause delayed wound healing. And then also it causes some a little bit less protection against photoaging and resilience to the sun. And you can see that in these pictures here that I have, that the young skin is a little bit thicker. It has more collagen in that deeper layer, and that does flatten out, and the collagen just doesn't form as easily with estrogen depletion. And then as an example, the medication aromatase, we do have aromatase. That enzyme is found in our hair follicles. So this just illustrates how one medication, an aromatase inhibitor, which is used to block estrogen production in the body, can have the side effect of some hair thinning or hair loss because our hair follicles are very sensitive to estrogen. I'm going to shift gears and talk about the sun. So obviously we all know the sun is extremely important to our life here on Earth, but certain things that it does that are good for us are it can help us make vitamin D, it boosts our endorphins. There's some thought that it can regulate the gut microbiome with circadian rhythms, and also it does help our own sleep regulation too. And going outside is very important for our mental health, relaxation, calm, perspective in nature. All of these things are why I want us to go outside. I don't want us to stay indoors and hide from the sun. I just want us to do it wisely so we don't get hurt. There are some detriments of the sun, skin cancer, as we're going to go into, wrinkling, aging, and then overexposure can cause immune suppression and fatigue. Like a very long day at the beach with a sunburn, you don't feel great the next day. So one of the effects of being a cancer patient and some of the medications is we can be more sensitive to the sun. That's called photosensitivity. You can also have a photoallergy or a phototoxicity. Photosensitivity as a general category is heightened reaction to sunlight, burning easier than you would normally. Certain medical conditions can do that. Certain genetic conditions can do that. Chemicals or plants can cause that too. And then radiation can also cause a photosensitivity. I have listed here all of the medications that have photosensitivity as a side effect. And this is just the categories. This isn't even the specific name. And so it can be a lot of different medications. You may be on one or several of these medications at different times in your treatment too. So if you are concerned about that, or if you do feel like you're more sensitive to the sun, read the labels, but also talk to your pharmacist because they're really going to help you through this. And it is hard. And obviously chemotherapies are listed on that. And a lot of the targeted medicines, that's kind of a big side effect for them too. Another thing I wanted to talk about is photosensitizing medications increase the sunburn risk. And why is sunburn important? Well, sunburn can increase our risk of skin cancer. And we know that breast cancer, people who've gone through breast cancer, we are at slightly increased risk of skin cancer. And I'm going to break it down into the different types of skin cancer so we know what to look for and which we're more at risk for and at what times. So being more sensitive to the sun increases that risk of sunburn, increases that risk of skin cancer. Being immunosuppressed increases our risk of skin cancer too, because our body can't fight the mutations that the UV radiation is causing. Also, certain genetics can cause it too. And the other thing is radiation can also increase our risk to skin cancer. And that is more likely to be the non-melanoma skin cancers, the basal cell skin cancer, and the squamous cell skin cancers. And that is likely to happen 20 to 40 years after radiation. But that depends on how you responded to radiation, if you had a dermatitis in that area from radiation, or if you've had lots of sun exposure in that area before the radiation. And then also at your age at radiation too. Patients who've been radiated prior to the age of 20 are at higher risk of getting skin cancers in that radiation field too. So different things to think about. But let's look into, screening would be, I would recommend doing it every year. And that depends too, if you have a genetic predisposition, if you've had a lot of sun, if you've had skin cancers in the past, and family history as well. And then other things, how fair you are, if you have red hair, those things will increase your risk too. But you do want to be aware of your body, check out your own moles, take pictures of your moles, and have someone take a look at your back. No one can see their back very well. I can't see my back well, and I'm a dermatologist. I can't see the back of my head well. So have someone check it out for you. We all know how important it is to lean on our community and our friends, and this is just another example. So the most common type of skin cancer is basal cell carcinoma. This will look like tiny, pearly, pink bumps, little blood vessels. It might bleed easily. It might feel like a sore that doesn't heal. These skin cancers are not as aggressive, nor are they usually life-threatening. They rarely spread, but in certain locations, you really want to get them early. You don't want them to grow, of course. They can be treated surgically or with a chemotherapy cream, and they are the result of sunburns from UVB radiation decades earlier, kind of when we were in our childhood. They can also occur in previously radiated skin cancer, as I mentioned, and that can happen decades later. The second most common type of skin cancer are squamous cell skin cancers, but before they get to that stage, they sometimes pass through a precancerous stage called actinic keratoses. These are precancerous lesions. They're from lots of sun over the years, and they happen in areas of sun exposure, like on the face. They are these rough, scaly pink patches. They can be treated with topical chemotherapy cream, liquid nitrogen, and they can be destroyed to prevent them from becoming skin cancer. Squamous cell skin cancers, they're the second most common. They can manifest in a couple different ways: a red nodule, bleeding, painful, even a little horn on the skin. And they're from chronic sun over the years and sunburns. They can also happen in people who are immunocompromised from viral infection, especially on the genital skin. So just want to talk about a little bit about immunosuppression there and why it can cause this type of skin cancer. These skin cancers are at higher risk for spread and invasion, especially in people who are immunocompromised and on certain sites. So previously radiated skin, so that's important for us, ears, nose, lips, head, and neck. And these are all areas which are exposed every day. We all walk around with these areas exposed to the sun. They can be treated with chemotherapy cream, surgically, targeted therapies, or radiation. And then, of course, melanoma. And Erin and I were chatting, and Melanoma Monday is happening on Monday. This time of year, we want to be thinking about our sun protection. And this is a very aggressive skin cancer. It's the third most commonly diagnosed skin cancer, and it's a cancer of the pigment cells. That's why usually it looks dark and black. Sometimes it can be a little bit more pink, and it can manifest in different ways. There is a risk of melanoma in people who have been diagnosed with breast cancer. This may be from radiation, maybe from overdiagnosis because we're getting screened more. It can be because of radiation therapy or chemotherapy, and it can also be due to genetics. And the biggest one for this is the BRCA2 breast cancer gene. That does have a significant increased risk of melanoma, but there's other ones too. CDKN2A is higher risk of melanoma, but it does have a risk of breast cancer too. And then CDK4, BAP1, and then there's a P10 mutation as well as a P53. Those have some more controversy around them, but obviously you want to get checked for skin cancer in those as well. Melanomas are more aggressive. They have a higher risk of spread. They're treated with surgery, immunotherapy, or targeted therapy. On men, they are more commonly diagnosed on the back. On women, they're more commonly diagnosed on the legs. So I want us to think about this when we're going outside in our shorts and our skirts and wearing dresses. And don't forget to put sunscreen on your legs. Sometimes we forget about that area. We focus on what we can see in the mirror, our chest, our ears, our arms. With a melanoma, we talk about the ABCDEs of melanoma for identifying it. What does it look like? You may have heard this before. Asymmetry, has irregular borders, multiple colors. So if you look at these melanomas, they might be pink and brown and black and white, maybe even look blue-gray, not just one solid color. They have a diameter greater than a pencil eraser, greater than 6 millimeters. And then they evolve or they change. It's growing. It just doesn't look right. And then I like to say the ugly duckling. It just doesn't look like anything else on your skin. So these are definitely reasons to talk to your provider, have someone take a look at it. So we're talking about UV light and the energy that we get from it. And so that means different wavelengths. And so we break it down into ultraviolet light, UVA, UVB, and UVC. And that penetrates our skin in different ways. UVC is blocked by the ozone layer. So mostly what we're exposed to is UVA and UVB. So ultraviolet radiation or UV radiation is a known carcinogen. And UVC is the highest energy. It is the most damaging to the skin, but thankfully it's blocked by the ozone layer. And in areas like Australia, where the ozone layer is more depleted, they do have a higher risk of skin cancer because they don't get as much protection. So adults in Australia, 2/3 of them will develop a skin cancer in their lifetime. So that number is much higher than in America. UVB is a little less high energy. It causes skin cancers, like I talked about, and that's going to target the superficial layer of the skin, the epidermis. It does cause delayed tanning, and that is the ultraviolet rays that are responsible for stimulating vitamin D production from the skin. But they are also the ones that are causing the DNA mutations too. So it's that balance of how much UV light do we actually need. UVA is lower energy, causes more immediate tanning, and it can contribute to skin cancers as well. The UVA is also going to penetrate deeper in the skin, and that damages the deeper collagen and elastin, causing more of the aging effects of wrinkling and sagging of the skin. And so that's obviously something we want to think about too. So what's our strategy to protect our skin from the sun? So it's multifactorial: sunblock, sun protective clothing, shade, and avoiding the peak sun hours. So it's not just one of these things. We like to use multiple things to really protect our skin. So the first thing you want to know is, what is the sun going to be like when you go outside? So you can look on your phone and the weather app, and it has a UV index. This tells you how much UV radiation is reaching the Earth's surface at your point in time for your location. And depending on the altitude, the season, the surface, that can all be a little bit different. So it gives you low, moderate, or high. Low, you may not need that much sun protection, but it does depend on your photosensitivity. Moderate to high and high to extreme, you're definitely going to use sun protection and maybe even change the time of day you were planning on going outside. Not all surfaces are created equal. Water, sun, snow, and concrete can all amplify the UV light and reflect on you. And that's why you can get a sunburn when you're skiing. Also, the altitude matters. The higher altitude, there's less atmosphere to protect you. And for every 1,000-foot increase in elevation, your UV exposure is amplified by 6 to 10%. So really think about that if you are traveling to the mountains this summer. Even when you're flying in an airplane, think about that too. And yes, you can still get burnt on a cloudy day. And it's also important for limiting those peak solar hours, the 10 a.m. to 4 p.m., and seeking shade too. And not all shade is equal. Some of the sunlight is filtered. It depends on the surface that you're on. And then, of course, don't use tanning beds. Please, please, please don't use tanning beds. I know you won't, because obviously you're engaged and you're all here and want the best for your health. And I respect that. One thing I want to mention is glass. So this picture here is of a gentleman who was a truck driver for 40 years. And it illustrates the effect of our windshield and our side windows. So he was a truck driver. He was exposed to sunlight coming in on his left cheek, and you can see there's increased sagging, wrinkling, nodularity, increased comedones or dilated pores, and his right and left cheeks just don't look the same. This is because our front windshields are made of laminated glass. There's a layer of plastic between the two layers for protection, and it blocks most of the UV rays. The side windows are traditionally tempered glass. They block some of the UVB, responsible for that burning, skin cancer, DNA mutation. But the side windows don't protect UVA, and that's going to be causing the aging of the skin, that photo aging, and contributing to some skin cancers too. So this just really illustrates that as well. Also, I want us to think about some of our cars might have moonroofs or sunroofs, and the type of glass really depends on the manufacturer and the type of car. So you want to look at that. And if you are really concerned about that, maybe you are on a photosensitizing medication, maybe you have a photosensitizing medical condition. Think about UV window tinting, wear a hat in your car, wear your sunscreen while you drive, because it does make a difference. Or if you work at a window every day, also think this sun is still getting in through the window. So now we're going to talk about sunscreen. And we've all heard the term SPF. SPF stands for sun protective factor. This is how long it takes for the sun's UV radiation to cause pinkness or redness and burning without wearing sunscreen compared to wearing sunscreen. So it just tells you how much longer you can be in the sun without causing that burn. But of course, sunscreen still needs to be reapplied every 2 hours. So it just basically protects us for a little bit longer. We want to look for a broad spectrum. That means it protects against UVA and UVB. You want to apply an abundant amount, a generous amount, a ping pong ball size or a shot glass sized amount that's equivalent to an ounce. And we want to make sure we're getting enough, because if you don't get enough, you might not be getting the same sun protection that you think you are. They tested it at that concentration for your whole body. So you want to make sure you're getting enough to get that protection. Apply it before you go outside. Reapply, especially after certain activities like swimming, toweling, sweating. And I wanted to clarify a few of the words. Sport just means it's formulated to stay in your skin longer when you're working out hard or, doing some of those more vigorous things. Water resistant is a change in terminology. It used to say waterproof, but now we call it water resistant. And so it still needs to be reapplied after you swim. It doesn't mean you can just leave it on all day and swim and towel. You still need to reapply it. Different formulations might be helpful in certain areas. A cream for dry skin, a gel for oily or hairy skin, and then a spray for hard to reach areas around the scalp. So you want to spray, and we've all seen people spraying at the beach where they're spraying and the wind is swirling it around. So you don't want to do that, obviously. You want to spray until you glisten. Then they tested it being on a consistent surface on your skin, a consistent coating. So you really want to rub it in or have someone rub it in for you because you want to make sure you're getting enough protection. And then one other thing is apply your insect repellent and sunscreen separately. Sometimes they can interact. The interaction might be irritating or cause kind of just not allow the sunscreen to work as well. I also wanted to go into sunblock versus sunscreen. And I don't want us to get bogged down by the terminology. We use them interchangeably these days. But originally, sunblock was meant to be defined as mineral or physical or inorganic blocker, which creates a barrier to reflect the UV rays, preventing them from hitting and penetrating into the skin. I like to think of it as these are the ones that are easy to pronounce: the zinc oxide, the titanium dioxide, the ones that you know what they are. And they sound like minerals. And you can see in the schematic how they're going to reflect the rays. They're not going to allow the light to go through. You want to look for ones that are non-nano, so the particles are not so small that they get absorbed into the bloodstream. You want to make sure that they're large enough. And this can also be helpful in more soothing, kind of dry, irritated skin using the zinc and the titanium. Now, they do tend to be a little bit more white. Newer formulations help with that when the particles are a little bit smaller, not nano-sized, but still smaller. But also you can get it in tinted versions, which I really like for the face, because it can almost be like a makeup for your face. Sunscreens, on the other hand, are chemicals that are actually absorbed by the skin. And these definitely need to be applied 15 minutes before you go outside because it takes that time for them to absorb and actually exert their effects. When they're absorbed, it either scatters the UV ultraviolet energy or it converts it to heat. Again, so it's not damaging the DNA and penetrating through the skin. These are the ones that are harder to pronounce: the oxynoctate, I'm not going to even say it, homosalate, oxybenzone, octreolene. So again, they're harder to be pronounced, but they are chemicals. Studies have shown that if you are applying them at concentrations where you're reapplying them all day long, small amounts can be absorbed into the bloodstream and be detected. They haven't determined that they are necessarily clinically relevant, but these can be detected and they are possible endocrine disruptors. So we talked about endocrine blocking because of our cancers. So I try to avoid these for that reason because they can disrupt our endocrine chemicals. So they also have higher risk of irritation and photoallergy, and they can burn the eyes and sting. And also they can damage the coral reefs. And so they are limited. You can't use them in Hawaii and other places. However, one thing I want to say is if you have the option of a sunscreen versus no sunscreen, just wear the sunscreen. It's so important to protect your skin. We don't want you to get a sunburn. So use what you have, but if you're in control of what you're buying or what you're going to purchase next, try to go more for the sunblock, the mineral blocker. And I just wanted to speak on balancing this idea of clean beauty and personal care products free from chemicals and those that are good for us and not hurting the planet, and sun protection. How do we balance these things? So the safest sunblocks are those that are mineral sunblocks containing zinc and titanium, and try to avoid, if possible, the chemical sunscreen endocrine disruptors, and also avoid other ones that are also disruptors or known carcinogens, ingredients with parabens, phthalates, and formaldehyde. And this can be very hard to do. I know personally it's hard to comb through your products. So I am really grateful to Unite for Her because they have a beautiful beauty product guide where they summarize everything and tell you why things might be more dangerous for your skin or something you maybe want to avoid. Also, there is a group called the Environmental Working Group. They have a guide to sunscreens, and they also have a healthy living app, which can help you with your personal care products and sorting through all that and try to avoid things that might be harmful to you. I also like an app called the Clearia app, where you can search for any personal care product, and then it will go through the ingredients and tell you if it's kind of like flagged red or dangerous and why. And it also does go into European regulation standards, which tend to be a little bit more strict than in the United States, just because of their guidelines.
Dr. Lucking, we did have one question that I think was relevant to that last slide.
Okay.
So just about sort of order of operations. So if a person is using a facial moisturizer, We had a question about what gets applied first, the moisturizer, the sunscreen. Can you speak a little bit to that?
Oh, that's tricky. Definitely, it's hard. I would say try to put your moisturizer on first, wait for a little bit, and then try to put your sunscreen on top. Or try to find a sunscreen that has a moisturizer already built into it, which would be ideal. And then use your separate moisturizer at nighttime. You know, at nighttime, we really want to make sure we're using a moisturizer. That's when our skin is renewing and healing. And so you want to keep some of your body's own moisture in by using the moisturizer then. So.
Perfect. Thank you.
And then I just wanted to touch again on special sites. So obviously our radiated sites are super important to protect from the sun. I mean, our chests may have been radiated. I know, of course, you're not going outside without a shirt on, but you know, wearing a bathing suit, wearing something that might expose those areas, we really want to protect the skin. And don't forget about the neck, and I call it the sternal notch, which is right at the base of your throat, and then the décolletage. And this is just the chest area. And a lot of our fun dresses or shirts might expose this area, even a collared shirt if you don't have it buttoned up. So don't forget to protect that area, because you don't want extra radiation to the areas that have already been radiated with x-rays. And then the tops of our heads, especially during hair loss from chemotherapy or from medication related thinning as well, because these areas still can get skin cancers in them, even though they have hair follicles. And then the ears, lips, nose, eyelids, and eyes. And that's kind of for everybody. But these, if you do get a skin cancer in these special sites, they're higher risk of being deeper or more aggressive, harder to kind of repair because they're special cosmetically. So we're going to talk about sun protective clothing. And they say that the perfect sun hat doesn't exist, but here it is. Every dermatologist is like, yes, go for this. Look at that coverage he's getting. So let's be more realistic. Okay, sun protective clothing, cover it up. This is when we're talking about the UPF, which is the ultraviolet protection factor. This is the amount of light that the fabric allows to penetrate through to your skin. So a UPF of 50 means 1/50th of the sun rays can penetrate. So it's 90% UV protection. And there's lots of clothes that have these UPF protection in it. I put some examples here, but luckily fashion is getting on board with sun protection too. And even if you don't have all your clothes in UPF protection factor, you can think about not all fabric is made equally. So dark or bright colors are going to absorb more UV light than lighter colors. So a white shirt has a UPF of about 7, and a wet white t-shirt has a UPF of about 3. And so that's really not protecting us from a lot of sun. And you may, as a youth, have been wearing a t-shirt and you went swimming and one of your parents said, like, put this on while you're swimming because you're getting a sunburn. It gave you a little bit of protection, but not quite enough. Also, thicker weaves and synthetic fibers block more light than natural fibers. And you want to have a slightly looser fit. If it's stretching tightly, more sunlight can get through the fabric as well. And a looser fit will cover more areas of your body. And you do want to have a wide brimmed hat, not as wide as that gentleman in the last photo. That is dangerous. Actually, I don't want you to trip. But a hat brim of 3 inches is what's recommended. And you can look for the specifications online when you're purchasing it. And then definitely wear sunglasses that have 100% UV and UVA and UVB protection. And then I just put up a few photos of, you can have an umbrella, you can have sun gloves, long sleeve shirt. I like the long sleeve shirt that's striped because it has a zip up collar. So again, it's going to protect that V-neck area. And that versus the one on the right, which is the red shirt. And that one has that notch in it. So just make sure to wear sunscreen if you're wearing something with a V-neck like that. And obviously you had a great presentation from Kesem, so I wanted to talk about sun protection for children. A quarter of our lifetime sun exposure happens during childhood and adolescence. Even one blistering sunburn or 5 sunburns where you get pink without the blistering can double the lifetime risk of melanoma. And unfortunately, we can't obviously turn back time, but we can move from here and move forward. And we can also protect children around us by using these same sun protection techniques. And baby skin, younger than 6 months of age, is especially vulnerable to the sun And most sunblocks are not tested on children under 6 months of age. So in this specific age group, I would use the mineral sunblocks. They're not going to be absorbed into their sensitive skin, and it's less irritating, better for sensitive skin. And then you really want to cover up, wear sunglasses, hats, and try to keep them out of that hot sun in the middle of the day. And for a catchy little phrase, as I said, Australians are at higher risk of skin cancer, so they have different guidelines than us, and they won't even let their kids outside without hats, sunscreens, and sunglasses, and they go outside at different times of the day. So they really have to deal with the sun more than we do in certain ways. So they say slip, slop, slap, seek, and slide. So slip on sun protective clothing, slop on a sunscreen of SPF 30 or higher, slap on a broad brimmed hat, seek shade, and then slide on your sunglasses. So it's kind of catchy. Now, I've already warned us against going out into the sun. However, the sun does something cool. It does something amazing. It helps us make vitamin D in our body. So we can get vitamin D from 2 different sources, from the sun and from our diet. So often I would have patients coming in to say, oh, Dr. Lucking, I just wanted to get like my vitamin D. I need to go out and get my vitamin D. But let's think about that a little bit more in a focused way and more carefully. So yes, vitamin D, it's a hormone. Its active form comes from diet or from sunlight exposure. Calcium and phosphorus regulation is mediated by vitamin D, and this is super important for our bone and our muscle health. And studies have also shown that vitamin D is important for regulating cancer cell growth and cell proliferation. It can help with infection, and it can decrease inflammation. And studies have shown that a higher level of vitamin D is associated with a better prognosis. And so really optimizing your vitamin D through diet, nutrition, or supplementation is really important. So we want a vitamin D greater than or equal to 40 nanograms per milliliter of 25 hydroxy vitamin D3. This is the most abundant form in our bloodstream that can be measured by your doctor or your care team. And as I said, we get it from 2 sources. If you want to get it from the sun, it really depends on the time of day, where you're located, the UV index, but also your skin type, your age, your liver function. And that's because the precursor is formed in the skin. So the UVB, as you can see in this diagram, is going to hit a precursor in the skin and convert it to a previtamin. And then your liver and your kidney are needed to change it into its active form and then do all the good stuff that vitamin D does. And so you can get vitamin D at hours where the sun is not so intense, like 10 after 4, before 10 a.m. And there is also technology that can actually help you calculate when and how to get your vitamin D through diet, but also by the sun as well, which is pretty cool. And then talking about dietary sources, look in your fortified plant or cow milk, juice, cereals. Salmon skin has high concentrations, other fish, egg yolks, and then mushrooms if they've been exposed to UV light. And then obviously supplementation, and then knowing your level, working with your nutritionist, working with your oncology team. So I wanted to touch at the end here about how we can use integrative health and really boost our skin health, because that's something that Unite for Her does beautifully. And I wanted to just look at it from a skin perspective. So obviously, as cancer survivors, everyone's always telling us you need to exercise. And I know you're all aware of that. But I just wanted to go into why it's important for our skin too. So when we exercise, it increases the blood flow to our skin. It helps with oxygen to the skin. And it's also detoxifying and helps with bringing antioxidants to the skin to combat some of the chemicals in our environment, pollutants, and things that we just come in contact with every day. You can also release endorphins and help with stress reduction. And again, these are things that sunlight can do too, but maybe we need a little boost from something other than the sun if we're very sensitive. And exercise helps with that range of motion restriction and fibrosis from radiation or from surgery. And it's also going to prevent or improve lymphedema, which we may suffer from. And then also can increase and boost the collagen growth, both in your muscles, but also can help with that kind of firming up of the skin a little bit too, combating the effects of an estrogen blockade that we might be on from our treatments. And I also wanted to highlight the importance of nutrition and skin health. So we're talking about eating the rainbow. So looking at these colorful fruits and vegetables, these are all examples of foods that contain powerful nutrients, the phytonutrients, antioxidants, flavonoids, polyphenols, all of these big fancy words. But basically what they're doing is protecting you against free radicals and UV damage and helping with cellular repair. So these are going to come in to play when your body is healing from all the onslaughts that we've had from our treatments, but then from day-to-day exposures to chemicals and pollutants. So think about all the different colors. So we're talking about omega-3 fatty acids, lycopene, those are often colorful red, orange fruits, beta carotene, some of the orange and greens, and lutein, kale, spinach, leafy greens, and then the EGCG, that's in our teas and some berries, and then antioxidants and histidine, that's found in cauliflower. And you actually do make a small amount of your own sunscreen in your body called urocanic acid, and it's not enough to protect us from the sun, but some of the precursors for that sun protective factor in our skin, which is about an SPF of about 3, they're found in cauliflower, which is interesting. And then vitamin C. And so vitamin C is actually a cofactor in collagen synthesis. And so I want you to think about this when you're eating a citrus fruit or a pepper or a broccoli, and think about how, like, yes, I am doing wonderful things for my skin and feel good, good things you're doing for your body. Conversely, we want to avoid processed and high glycemic index foods. These can boost our insulin levels, increase more of that oxidative stress in our bodies, and that's reflected on the skin, and it can disrupt the gut microbiome. And there is more literature out there that the gut and the skin work together. And so for all the reasons why it's good for your overall health to avoid those processed foods or some animal-derived food products, it's also good for your skin too. It's just another reminder. And then I did touch upon AGEs here, advanced glycolation end products. So these are things I like to think of as when we caramelize food and like baked goods, and they turn brown and they look delicious, and animal-derived foods where they're cooked at high heats and they're caramelized. That can also cause stress and inflammation in the body and in the skin, accelerate the skin aging because the collagen can't form correctly. And then it also kind of impairs, it's been shown to impair cognition and then boost diabetes. So just something to think about too, because we really are what we eat. And then finally, we're going to stop and smell the roses. I know these are tulips, but it's spring. So here we go. So mindfulness, relaxation, and skin health. And so if we think about, being stressed and our body is tense and all that muscle tension and inflammation and wrinkling of the skin, so that's just manifesting all the tension. But doing relaxation techniques and something like meditation has been shown to lengthen something called telomeres, which are kind of a hot topic in science. This is the protective DNA at the end of our chromosomes, and it shortens with aging, and it can shorten with stress, and you can actually repair it. So like our body can repair this damage, and relaxation and meditation have been shown to do that. Also going out into nature, and I do want you to go outside and enjoy the sun, immersing yourself in nature. They've shown that when you go out in nature and do something called tree bathing, or in the forest, it increases natural killer T lymphocytes. And I don't know about you, but as a cancer survivor, I want my body's own killers to be augmented. And so this is just another benefit. And then deep breathing and relaxation is going to stimulate and move around that lymph flow as we, move our diaphragm, and that helps too with lymph movement, again with detoxification and moving our body's own healing properties around. And then just feeling good, mindful movement, music, art, visualization, enjoying the beauty of life. That's what I hope for you all. And I want us all to have fun in the sun, to bring our hats, to wear a sunscreen. And I took this picture on a cancer survivor adventure that I found was very transformative. And I know we were talking about Camp Kesem this evening, so I wanted to just offer you a list of adult survivor adventures and retreats that are out there too. I've benefited from them, and I hope that you may do that too and experience that same joy. So I'm open to questions. And this is me in my sun protective gear. So I got the shirt on and the hat and the sunglasses, and these are UV pants, and all my sunscreen. I actually have sun gloves on too. This is at like 7,000 feet at a survivor camp. So think about the elevation and increasing that UV exposure. So
It's great.
Wow.
So good. I know. I have
Thank
lots
you.
of questions.
oh dear.
I think we all do.
There's a lot of questions in the chat. I think some are a little scary. I ended up texting my brother and my nephew, who are both truck drivers, and I'm like, "Do you know this? Do you know this? Look at this! Look at this picture! Look at this photo!" So it's very good. It's very good. Okay, Erin,
Our
let's get started.
pilots
We have
too,
some
and
questions.
our flight attendants too. If you think about being up high in the plane, definitely think about that too. And if you're traveling, wear your sunscreen for that reason.
Yeah, yeah. No, I know I have a little work to do. Yes, I have a little work to do. All right, Erin, get started.
Yes, I know. A lot of it you covered. So thank you for going over the
Yeah.
steps for moisturizer and sunscreen. We had the question, what are the safest sunblocks and sunscreens? So I feel like you mentioned that, but I don't know if there's particular brands that you like, if that question was generated around looking for different brand recommendations.
Oh,
But if
that's a
not, you did mention some good resources. We have our Unite for Her beauty guide and some other recommendations that we can share for brands also.
right.
Yeah.
I mean, I can tell you what I use personally, but and if you'd like, I can work on a list of some brands that I recommend, and I can, I don't know how to share that with everyone. Erin, what would you recommend doing there?
You can email them to me. We'll include them with the
Beauty
slide
guide.
with you. Yeah, and with the beauty guide. I know Jolene has also
She
listed
has a list.
sunscreen brands as well, so that's on there. So I'll go ahead and link our beauty guide as well. But if there's any of your favorites, Dr. Lucking, that you want to share with us, pass them along to me.
And I can put my list on my website too,
Oh, yeah.
in like a blog post. And so if anybody wants to do that too, I have many thoughts, I have many favorites.
Perfect.
Yeah.
Perfect.
What I think we can do, and something, Erin, that I don't think I was so in tune to, sunblock versus sunscreen. So if we can get Jolene Hart to actually give us the clean sunblock sunscreen versions, I think that would be a nice add to our beauty guide. So we can do that, and then we also can have your list as well.
Okay.
Yep.
I love the idea.
Yep.
Yeah.
So we had a great question come in from Heidi, which I love this. So she's a breast cancer and BRCA1 genetic mutation. She's been getting skin checks once a year before her diagnosis. Does she now need to get checked more than once a year since she's at risk for melanoma due to her BRCA1 mutation? Is there a better way for her dermatologist to check her skin besides just looking at it, like blood tests or particular machines that she should ask about?
So good question. There really isn't a special machine that does it. They're trying to do artificial intelligence to try to do some mole mapping, but nothing has been standardized yet. You can get full body photography that can be done. That's like medical body photography, usually done by a specialized person who's trained in this. And they can help with mole mapping and things like that too. There is no blood test that would determine if you had melanoma. So usually it's more about looking and seeing. Your risk of melanoma is not much higher with BRCA1. It's more with BRCA2, where that risk is 2 to 5% higher. But that being said, I would still get checked regularly. And I don't think that there's anything more specific for that. It's more about you personally. So if you've had, maybe like a dozen sunburns in your life, if you've worked outside, if you were a lifeguard as a child, if you have if you have a family history of melanoma, and if you have red hair, these are all different factors that your dermatologist would be taking into account. And it's not always the gene mutation that's driving it. For that specific mutation, there are other ones where that risk is going to be much higher. I hope that helps.
Yeah, that's great. Thank you.
Erin, we had another here about the facial moisturizer. Was that the one you were going to ask?
The Revision, yes. Yeah.
Go ahead.
So Janice asked if you heard of Revision moisturizer. It's a 50 SPF. She uses it every day on her face. Is that good enough? She feels like it does a good job.
If it's 50 or is it 15? Pardon me, I didn't hear.
50. Sorry.
Yeah, that'd be great. just make sure if you're using it as a moisturizer that you do reapply it if you're going outside again. Sometimes I think we put the moisturizer on first thing in the morning. It's part of our beauty routine. You're doing a great job. Brush your teeth, put your moisturizer on, good to go.
Right. And then we
Just don't
stop.
forget that, driving home from work, you're getting sun exposure again. Or if you go out to dinner after work or, later in the day, you're going to need to reapply.
I think with that same
Right.
one, I don't know if we addressed this or not, but it was, I know when I put on a facial tint, foundation that also has an SPF in it, I think I'm covered. Do you
Mhm.
need to have actually a sunscreen and then you put on that? Or are you covered with these like, type of,
A
I guess
CC cream.
yeah. Hmm.
So it depends on the SPF. If it says it's more than 30, I would say you're covered. But
Okay.
just apply. And then the other thing too is often people forget to come down here. So we put
Right, right, right,
the
right, right, right.
sunscreen or the makeup on here, and then just you forget about your neck, we forget about our ears. These areas are still exposed, and especially for radiation, right here is exposed. You really want to make sure not to forget this.
Great.
Yep.
Okay, Erin, you want to go to the next one?
Yeah, we had a great question about sunglasses, which you sort of touched on with your apparel, but best sunglasses to protect, or what we should look for when we're buying sunglasses.
So you want to look for 100% UV protection. That's going to cover 100% UV protection is going to be UVA and UVB, or it can say UV 400, and that's just talking about the wavelength of light. So that's going to include that UVA, and that's why it says UV 400. So, but 100% sun protection. And so you're really going to have to look at the actual glasses themselves and look at their specifications. And even when you're looking at them, you want to make sure that they wrap around. You don't want the sunlight to be coming in. Some of the sunglasses now are huge and sit off your face. So
Yeah.
that really protect you more better.
Mhm. Gotcha. Jill had asked, can you speak to the risk benefit of chemical versus mineral sunscreen?
I'm wondering
I
what
think you talked about this too, Erin.
I'm not sure what she means by that. Like, which is better, or how risky is
Well,
chemical?
yeah, I think you touched
Yeah.
on that, Dr. Lucking, sort of between the two, chemical versus mineral. And you sort of mentioned the best sunscreen is, if you want to use a chemical sunscreen, it's better than not using a sunscreen at all. So I feel like
Oh,
that may be the origin of that question. Or Jill, if you want to come off of mute, if you're still here, and sort of clarify.
I think that I understand what you're saying if we're going down that route, and Jill can always hop in. But yes, the best sunscreen is the one that you're going to use, hands down, because it's so
nice.
much better to wear sunscreen than not wearing
Then none at
sunscreen.
all.
Yeah. And some of the risks, when they looked at the amount in the blood, it was a very small amount that was detected in the blood. And this was applied in a way that we would, like if we were going to the beach, like full body coverage every 2 hours. And I don't know how many hours, but I would assume it was like a long day, like 8 hours. I can look at that data, but that was when it was detected in the bloodstream. So again, these are small levels. Now, maybe if for you, you're going outside every day, maybe you're a lifeguard or maybe you work outside. And so that would be significant. If this is an everyday occurrence for you, if this is a week at the beach and you're sweating and you're toweling a lot, and this is the one that stays on you, then I think that's really important because I want you to be protected. So,
Yeah. I think I saw Jill come off her mic. If you're still
You
there,
you
Jill.
answered my question. Thank you so
oh,
much.
good.
Perfect.
And I do think that this is something that's going to be evolving and changing for sure. I mean, the reef safety was only recently put out there a few years ago. And so I think there's that aspect of it too. And so that will start to come into play. So something to watch and see.
Great. Okay, Erin, what
Wonderful.
else do we have that has not been answered?
Well, there's a question about clothing, which I also wonder about. How often does someone need to get new SPF clothing? Like, do I need to buy new clothing every summer, every year, or how long does it last, or is it number of washes? So that's a great question if you
It's a
know.
great Yeah,
Yeah,
great question.
I also wonder that as well. Um, but I don't think you need to buy a new one every year. I do not. I think you can kind of tell to some extent, like you can start to tell when things are looking a little threadbare
Breaking down.
or breaking down. My one son has a
Mm,
sun shirt where I would like hold it up and be like, I can see the sun through this. This is not working anymore. And I think
yeah,
one of the things that affects the sun clothing the most is when it is exposed to chlorine or certain chemicals or washing frequently. And so that can damage the fibers a little bit more. So that's where I tend to see the breakdown the most. And that's why if you are going to be using it in the pool, make sure that it's rated for chlorine or for, water usage. And I wouldn't necessarily dry it in a dryer either if you can avoid that. Like really try to follow the care instructions on the label carefully, just to make sure that you're not breaking it down faster than it needs to be broken down. And I know it's expensive. A lot of the clothing can be very expensive. I don't
yeah.
want you to run out and go get like a whole new wardrobe. Um, Sometimes what I do too is I'll have a sun shirt that's like a button up or has a snap on it, and I'll put it in the car. And then when I'm driving, I just put that on over me. Or if I'm going somewhere, I'll just kind of put that on over my regular clothes as a go-to.
I love that. That's a
Great.
great suggestion, actually. Yeah.
Yeah.
We had another question real quick, and I know we're going over time, so maybe we'll just grab one or two more. Self tanners. What do you think about them? Are
Yeah.
they safe to use? Is it a good alternative?
Yeah, so self tanners are safe. I know that on the beauty guide, the Unite for Her beauty guide, they do have a few recommended that are safe from some of the chemicals that I would avoid. And it basically just causes a darkening of the skin. It's a chemical reaction in the skin. It is safe, and they are okay to use. Make sure you wear your sunscreen on top of them. They do not protect you from the sun unless they say SPF on them, and some of them do, but they are okay to use.
Okay,
And the
great.
spray ones are okay too. Like a spray tan is fine. Just make sure not to breathe in the chemicals. We do not need them inside our bodies.
Yeah. Donna had a question about what can be used to protect lips. I know I use a chapstick with SPF. Is
Mm,
there anything
yeah.
else that you would recommend?
No, I would definitely use a sunblock. Again, I would go more for the zinc and the titanium, those physical blockers, because the lips you will eat it. And so you would be ingesting some of the chemical blockers, and we don't really want to do that. But I know it's hard to find some of the physical blockers. Those are going to look a little bit whiter on the lips too. And sometimes I have a hard time finding 50. So we want to make sure you reapply. That one you want to keep in your pocket, reapply
Great.
a little bit more frequently too. Um, I can add that to my list of things that I recommend as well. I use one from
Yeah.
I think it's called Sun Bum. That works pretty well. So, but a lot of
Yeah.
people
I
forget
feel like,
the lips. A lot of people forget the lips.
yeah, I know. Well, and it just comes off more than you realize because you're talking, you're licking your lips, you're eating, I think we have an update version for Jolene's guide coming our way to make sure we have the most up to date based on what we learned today.
Oh,
There
someone
was
just
Yeah.
one.
sent a text, Vanacream lip. I like the Vanacream lip too. That's a good one as well.
Oh, awesome.
I'd have to look at the
Wonderful.
ingredients on that. But I've used that before and I like it, but I just have to check out the ingredient list on that.
Perfect.
There was one question about prescription sunglasses. Did we, or not, prescription glasses, not sunglasses, just people who have glasses. Did we answer that one? I'm sorry if we did, but
Oh,
just like you're going out and you're wearing your glasses, they're not sunglasses. You need a prescription. I know I don't have prescription
like what you
sunglasses.
have on. Yeah, that's a great
Right.
question.
I'm not an eye expert, but I do think most of them are UV protectant. I don't know the extent of the UV protection. And that would be something good to ask your optometrist, I would think.
Just
But
your regular glasses. Hmm.
mhm, mhm.
Okay.
Love that.
Okay. We have some homework, Erin.
We have a lot of homework that we will be
We do.
discussing. So, but
Yeah.
in the best possible way. So this was tremendous and so
Hmm.
timely, Dr. Lucking. So yeah, we have done a lot of learning tonight, and we thank you for your time. And I'll make sure that we share your slides as well. So this, along with the recording, Dr. Lucking slides will be in her library, so we can all go back, check out the camps she offered. We can just re-review some of those details as well. So So we'll have that up in our video library this week. But this was, yeah, very valuable and
Great.
outstanding. So thank you.
Now I have a few more questions, but I think I'm going to have to email you.
Thank you all so much.
It's great. Thank
for your
you. It was
time.
wonderful.
Thank you.
Appreciate you.
Thank
Got
you.
it.
All right.
All right, Erin, that's a wrap.
That is a wrap.
2 days in May and 2 down.
I know.
We
And
just went
two
in. We
great
just went
ones
in
as
fast
well.
and furious. Yeah.
We're moving
We
and we're
did.
protecting our skin. So I love
Oh,
it.
we
But
are.
remember,
Yep.
we've got our speaker series next Wednesday as well. So we're talking with 2 experts from the Sidney Kimmel Cancer Center about medical marijuana and cannabis in the cancer community. So definitely check us out next week. That's Thursday, 6 p.m. Eastern time. But as always, it'll be recorded and in our Her library as well. So
Yeah.
Everybody enjoy the beautiful weather safely.
Yeah. Another shout out to our sponsors that support us. So Wes, Merck, Daiichi Sankyo, we are grateful. They are presenting sponsors. And then we have help with GSK, Lilly, and EO, which is the ones that are doing the presentation next week. So we're really, really happy for that investment.
Perfect.
All right. I am going to button up my shirt, ride my bike home, put a hat. I have a helmet.
My work here is done.
Great. That's right.
I don't
Success.
have a yes, yes. It's great. Well, thank you all. Have a great evening. We had such a good showing, and that's it for today.
Yeah.
Bye,
thank you,
everybody.
everyone.